what it's talking about.
Yes.
Because you can actually converse this thing and then visualize it.
Yes.
And then come up with a deductive conversation.
Yeah.
When you talk about general funding of healthcare, then it doesn't really come home. Let's go by bit, and I think that there are 4 areas that you can actually be able to trace and see whether the national government has been able to actually empower health services in the counties. The first thing is facilities. Healthcare facilities start with, let's say, just say buildings. Yes, right? You build a dispensary here or there.
And for that, the counties have done well.
Yeah, the question is, have the money that have gone to the counties built a number of healthcare facilities? Because the main question here is taking primary healthcare function to national government. Because
so you both agree
that even the
infrastructure is done well.
That infrastructure is very well done. And as a matter of fact, I've studied healthcare in the context of experiential learning, whereby when in my community, when my dad or my uncle is sick, how do they behave when they're sick? There's something that he will tell you is called placebo effect. Placebo effect is whereby by either counseling or putting in a certain environment alone, your mental state or your physical state as a health person gets better by just being in a facility other than home. If you take our people away from their home today and just get them in something that has been built well, even without the other functions I'm going to go to, and then you say, you are in the hospital, my dad starts eating, he starts behaving well. That placebo effect has been there in the counties that has improved health. The second thing becomes, when they get there, who do they meet? That is called personnel, which is the healthcare workers, the doctors, the nurses. That is where we have had a bigger problem, because there have not been serious employment. And even where counties have done a big job in terms of having people like community healthcare workers. There used to be a community healthcare volunteers where the people are reaching people. The national government has not been forthcoming in terms of helping. In fact, right now they're proposing that the county should introduce 2,500 contribution, and the national government introduces 2,500 contribution. Good idea, but why can't it just be housed by the counties? The third issue that has been there is that when you're diagnosed with any form of disease, can you be able to get medicine? Okay? And it's sometimes a very simple medicine. It could just be a stabilizer or something just to make you kill pain. And medical issues have been a problem because those funds are not coming to the county. Then the fourth issue, which has been the issue that we have been fighting about in the Senate, is now the medical equipment, which is basically, can we have a sophistication that can be able to help these institutions that you have built, whether it's a dispensary or a healthcare, that if there's a complexity that we cannot be able to deal with just by simple diagnostics, can we be able then to take further steps, give you some x-rays or before even we refer you? Because remember, the referral function is still, the national referral function is still for the national government. Before we refer you, can we be able to do at least some basics?
So in these 4 parameters, are you satisfied with what counties are?
Yes, I'm coming to you. I want to give you statistical. That's why I say if you go concrete, we can be able to talk. The money for medical equipment has always been allocated, but the national government has refused to give it. I dealt with something called DORA, and I'm in finance committee. The medical equipment services money was mostly being managed by what we call MDAs. Okay? These ministerial departments and agencies. They refuse to give it to counties. What does that bring? Counties cannot plan. When you start drawing contracts for medical equipment and choosing for counties what they need, and you are managing at national levels, the counties cannot be able to prioritize. They cannot get value for money for these things. And most importantly, they can't monitor and evaluate the functionality of that particular contract. To the extent that even this DORA that we have just passed, that you saw, we were fighting with the Kenya Kwanza senators in Senate to pass that DORA. There was a pending bill of 5.6 billion that the national government accepted. The Treasury accepted that this money needs to be given to counties to manage it directly, but it was being managed by MDS. And that has been the problem. The fact that you have devolved a function, you cannot understand the priorities of this medical equipment, you cannot structure contracts for these counties, yet you still want to be able to control the money. Now, what is the problem there? I can tell you for a fact, and without any kind of mischief, that is just pure greed. That people want to control the monies that counties are going to use on those, especially those 2 facets, drugs and medical equipment services because of controlling tenders. Right now, he knows that the conversation that they are having with State House, he knows very well that already the ministry has already said that they want to go as low as tendering 90,000 kits for community healthcare workers. They even changed the name now to what we call health promoters. I mean, what is that if not tendering? Okay. Because explain to me how CS Susan wants to go to the village of Kabondo or to the village of somewhere in Elwak in Mandera to be able to dictate to them the functionalities and the kind of kits that CHVs should be able to work with. Give it to counties. They can manage it better.